Up next, a special panel discussion with the Missouri Department of Mental Health Leadership. This presentation will be the first of 2 panel discussions with DMH leadership. During this time, individuals will be able to ask questions and learn new information by using the chat feature. Deborah Walker, Director of Public and Legislative Affairs, will facilitate the discussion. The speakers on this morning's panel include Deputy Director Valerie Hoon, Division of Behavioral Health Director Nora Bach, Chief Medical Director Dr. Angeline Stanislaus, and Division of Developmental Disabilities Deputy Director Wendy Witzig.
All right. Well, I am excited to bring together some team members here from the Department of Mental Health to talk with you a little bit about things going on here at the department, as well as answer your questions. So if you have the opportunity, go ahead and start pumping those questions into the chat, and we will be sure to pass those off to the right team members that we'll be able to answer those questions for you. This is something that DMH has done at the in-person Real Voices, Real Choices consumer conferences in the past. And I know that the audience members always enjoyed having the opportunity to pass the mic around in a really large conference room and ask questions of the various leaders within the Department of Mental Health. And so we're gonna do this virtually this year. We didn't do this last year, and I feel like we kind of missed it. So really excited to be able to bring you once again some of our excellent leaders and team members from the Department of Mental Health to answer some of your questions this morning. And as the introduction said, we are going to have with us and here they come, right on cue. All right. Good morning, friends. Hello.
Good morning.
All right. Good to see you all. We have with us Deputy Director Valerie Hoon. We have Dr. Angeline Stanislaus, who is our Chief Medical Director, and we have the Director of the Division of Behavioral Health, Nora Bach. Thank you all for joining us this morning. Dr. Stanislaus, while we're waiting, it takes a little bit of time for some of the questions to come into the chat. So as we're waiting on some of those coming in, let's talk about what is on everybody's mind. And we've even seen some comments this morning about COVID. Of course, that is why we are not in person once again this year for this conference. So Dr. Stanislaus, let's begin with you. And what kind of advice would you give our participants regarding COVID-19 and vaccinations in general?
Well, it's year 2 now of COVID. We were hoping that it would be just, you just flatten the curve last year, spring, and it will just go away. Unfortunately, that's not what has happened. Now we see waves. We saw the first wave in spring of 2020, then we had the second wave in April and winter of 2020-21, and now we are in the third wave, which started in July of 2021, and it continues to go through whole of Missouri. It started in southwest corner of the state, and now it's everywhere. We are hearing more and more about it. You cannot escape COVID if you were to get on any news media or on any just open your computer page and you see COVID. We hear about beds getting full in the St. Louis region, Kansas City region, and pretty much across the state. And what is different this year, this time, compared to the other 2 waves? We have a new variant, which is called the Delta. Why is Delta different? Well, coronavirus has made some changes into the spike protein, the little spiky thing that comes out of the virus. When it's changed a few of the proteins around, and because it did that, it made it much more easier for it to invade the human body. I mean, it just sticks like Velcro. It sticks very quickly to the nasal cavity of the individual and then multiplies very, very, very quickly. It multiplies much quicker than the previous strains of the virus. So it multiplies very quickly, And then it also makes the person more infective very quickly, meaning by day 2 of this virus, people are infected. So that is why it is spreading so much faster. And the other thing is also what we are seeing is it also causes more damage because it multiplies so quickly. So that is different. But the good news is we also have a vaccination.
And what is your recommendation in regard to vaccinations? I mean, I know there are questions that people still have about the vaccinations, but I know that within DMH, we are pro-vaccination. We know that that truly is kind of the path toward getting through this pandemic.
Yes. So the vaccination is actually it, what it does, it mimics the virus in so many ways. It goes into the body and then makes the proteins or the antibodies, which is the fighter proteins in the human body, the fighter immune system, that it really boosts the fighter proteins in a human body. So when the virus gets in contact, when it comes into our body, it is like little fighter cells that are ready to fight it and fight them before they have a chance to invade the body further and cause more damage. So they are another a big defense system that we have in our body. So the vaccination, there are 3 types of vaccination, and they all do the same. Some of them produce just the spike protein antibodies, some for the whole virus, but it is basically very, very similar. The vaccinations do prevent the person from getting ill, really, really seriously ill. And that is important. It is not the virus that we are worried about. What we are worried about is the illness, the serious illness that can come in the human body once it attacks us, and the fact that you can become so sick that your lungs are not functioning anymore, and you're ending up needing oxygen, and then also, if needed, external forcing of air inside your body or a machine breathing for you, which is what a ventilator is. So that is what we are worried about. So it's not the virus itself. And so the vaccine gives the protection that it prevents the body from becoming really sick and seriously ill and needing more and more oxygen, or ending up needing another machine to breathe for you when you do get the virus.
So just real quickly, we've got a couple comments in the chat. Someone mentioned that they are fully vaccinated, but they're still kind of afraid to go out, and didn't know if you had any suggestions for easing her mind. And then, of course, another comment saying not everyone can get vaccinated, which is also true. And so this person was encouraging everyone to still social distance and please wear a mask, which we are pro mask and social distancing too. So any information for our participant that you might be able to ease the mind, and then we're going to move into some other questions.
Certainly. So I would say that because the Delta variant is so much more potent and able to invade the human body quickly and multiply so rapidly, my recommendation is, even if you're vaccinated, make sure you mask. The only way the virus can leave one infected person to another person is through this triangle, the nose and the mouth. If there's no saliva getting out of the mouth and there is no forced air getting out of the nose, the virus does not get out. And the only way the virus enters another human's body is through the same triangle, through the nose and through the mouth. So if you have a mask covering this, you're not going to get it out, and the other person is not going to suck it in. So masking, whether you're vaccinated or not, if you are is the way to go. If you really want to, whether it's so important that you mask covering your nose and the mouth. The second thing to remember is the social distancing. So if you are masked and you leave space between you, it is really going to help, especially if you're in closed spaces. So my thing is, go out, do things you like, but whether you're vaccinated or not, make sure you wear your mask covering your nose and the mouth, and you leave enough gap around you. And with that, you can go back to some kind of normal activity.
Sure. And someone else pointed in the chat that, they know of people who, and Val, I'm going to kind of toss this your way. They know of people who are vaccinated who still then tested positive for COVID even after they were vaccinated. And that's true. And as Dr. Stanislaus mentioned, the Delta variant is really the primary cause for people vaccinated, unvaccinated, still testing positive for COVID. Val, how important is it that people are searching for the right kind of sources of information about COVID? Talk a little bit about that, if you would.
Yeah, thank you, Deb, and good morning, everybody. Thanks for joining us on a Monday morning.
Yeah.
So one of the things that the state of Missouri, and really all states and the CDC have worked on, is pushing out information that is factual. And we all have really active websites that you can get to very, very easily to see case data, to get frequently answered question information, and any of that kind of stuff. So it's all out there. It does take effort to get to it, but it's really easy. So in Missouri, you just go to health.mo.gov and you can go to the COVID dashboards, you can go to the frequently asked questions, and you can find all of that information. Even if we don't necessarily have all the data out there right now for Missouri, because we are working on getting it up to date, other states may have that data and we use their data as well. So an example of that is the state of Virginia right now actually has information on vaccination and breakthrough infections, or infections on people who have been vaccinated, including how many of those end up in the hospital and how many of those unfortunately ended up in death compared to folks that weren't vaccinated. And that's information that is really important. Remember, vaccines are not intended to be 100% stopgap. We know that vaccines have a limit, are still limited, but they help a lot of people. So for example, with the state of Virginia, they have 4.7 million people in Virginia who have been vaccinated, and only 10,712 of those folks have actually gotten a COVID breakthrough infection. So yes, it does happen, but it's a very small number. Of those 10,712 people that got a COVID infection, only 404 of those individuals were hospitalized. So of 4.7 million vaccinated Virginians, 404 got COVID and ended up in a hospital. Then even further, and unfortunately 83 of those 404 individuals did go to the hospital or did actually end up dying. But you can see what a difference that makes. And as we're able to get that data out for folks, we really do try to do that. But please look at the Missouri Department of Health's website. They have a lot of good information. Also, the Department of Mental Health on the Division of Developmental Disabilities side does currently a call every 2 weeks that is open to the public. So everybody can register, call in and listen, and we will show you how to get to websites when there's new information available. We'll remind you about information. We answer questions in the live chat, just like what we're doing right now today. So those are just a couple of ways to help make sure you get access to the information that you need.
Awesome. Thank you, Val. There are some questions that we're going to get to, but I also want to shift gears just a little bit because the Department of Mental Health has had a good year as far as the budget goes, and there are some new tools that are going to be in a variety of communities around the state. And Nora, I'd like to toss over to you to talk a little bit about some funding that the Department of Mental Health received, and we'll be partnering with community mental health centers to put together some additional crisis stabilization centers around the state. Can you tell us a little bit about these centers and what this funding is going to be able to help us do?
Well, I will do my best, Deborah. So good morning to you, the panelists, and all of those of you who are joining. I am super glad you are still able to do this event, despite it being virtual. So what Deb was referring to is crisis stabilization units are going to be located across the state. There are some already in place, and what they are there for is to help individuals who have some sort of behavioral health crisis, might be mental illness, an acute episode of that, it might be a substance use disorder. Many times it is combined, and oftentimes when that happens in the community, police are called, or individuals end up going to General Hospital's emergency room. neither of those things are an ideal outcome for individuals who are in crisis. We really want to get them to people who can help them deal with whatever's happening. For some people, it means an increase in symptoms that they are not being able to manage. For others, it may be just being overwhelmed. And so they've used drugs or alcohol and end up having some interactions with law enforcement. The stabilization centers, there are some that are 24-hour a day, and there are some that are defined as urgent care, so they have limited hours. But these are located across the state, and they are staffed with mental health professionals, doctors, so whether it's a psychiatrist or an APN, someone who can prescribe medications in a pinch, peer support specialists, case managers. And what they do is police have the opportunity, if they come into contact with someone who's having that kind of crisis and it's not appropriate for them to go to jail or otherwise be involved in the court system, they can drop them off and those folks can get stabilized. So that might mean talking through some of the crisis with, again, mental health professionals, peers. That's been very important for us. They might need some medication to get back on track. It also helps, so that gets our law enforcement back out to doing what law enforcement needs to do, because our law enforcement, even though they're really improving their knowledge about mental health issues, that's not really their main job. That's our job. Same is true for the healthcare system, and it kind of dovetails, frankly, with the COVID crisis. We want our hospitals focusing on individuals who have severe medical illnesses or injuries, and we don't believe, again, that individuals who are seeking help in those settings for mental illness or substance use disorder, that's probably not really the best place for them to get immediate care. So we had some existing ones in the state. They were in Kansas City. We have an urgent care in the Kansas City area, also with KCATC, different places. There is one in Springfield, one in St. Louis, and then one in Joplin. Those are existing. What the budget did was give us money to bring up more of them. So to renovate spaces, to make them trauma informed, and to make it a safe and secure, welcoming environment for individuals who may need those services. The new ones are going to be coming up, and it varies in size, how many individuals they can serve at any one time. We will see St. Joseph, Hannibal, Jefferson City, Cape Girardeau. The city of St. Louis is getting something specifically called a sobering center. Wentzville, Kirksville, Columbia, Poplar Bluff, West Plains, and most likely Rolla. So they are coming up at various times during the next several months. As you can imagine, folks are at different stages of readiness, but they are working really closely with law enforcement and hospitals and healthcare providers and the community to be sure that whatever is put within that community, everyone understands how to use it, and it's perceived positively, and folks are open to using it. Does that help, Deb?
That's great, Nora. And you actually addressed several of the questions that kind of popped up in the chat as well as you were speaking. Yes, the officers, not just CIT trained officers, but all law enforcement will be familiar with these stabilization centers in their communities and be able to know when is the right time to divert individuals to that center. So that's great. The one question that was brought up that we didn't address is this something that can be used for children or youth, or is that something that is still kind of in the works?
That is a great question. There's probably just a couple of those that are going to be able to work with kids immediately, but there are plans about that. As you can imagine, it's generally adults who tend to run into issues with the law enforcement more times than it is youth. They have a different pathway in, but it is recognized that kids do get into crisis, and we know there's not enough resources for them. So we want to carefully plan how to bring those into that environment, because we want to keep adults and youth children separately for lots of reasons. But that's happening in some communities. It's not happening on a large scale. So we really, some of these towns and communities and cities are still in that planning phase of figuring out what is most needed and what this can do. And it can't meet every need, but we hope it's really going to assist a lot of individuals who might otherwise end up in those other places.
Absolutely. Thank you, Nora, and noticed some comments about how awesome it is to be able to getting this to be able to cover more of the state in getting some of this assistance. We started off talking about COVID, and while I think we all can probably agree, COVID really kind of put a damper on life in general. However, let's talk about a silver lining that has kind of come out of COVID-19, and that is a program that Department of Mental Health is partnering with. It's a program called Station MD. Val, can you tell us a little bit about Station MD and who that is helping and how that works?
Absolutely. So Station MD is kind of a telehealth triage medical catch-all option for individuals that are with the Division of Developmental Disabilities. So if you are case management only, if you are in self-directed services, if you are getting employment services only, if you're doing autism, if you're in a residential setting, everybody getting services through the Division of Developmental Disabilities can access Station MD. What Station MD does for us is they are doctors and they answer medical questions. So instead of maybe going to the urgent care or going to the ER, you can call Station MD and they can assist you immediately. And they can help you solve some medical issues on the phone. If they can't do that, then they will call ahead to an urgent care or to an emergency room so that when you do need to access that facility, you can do so quickly and the doctors are educated about what your needs are. We've got lots of Facebook Live events out there that talk with families and providers and individuals that have used Station MD. All folks have really enjoyed access to this service. We started this service because of COVID, because we knew folks would be apprehensive about accessing emergency room care or doctor's offices because they were afraid of getting COVID. But what we found were that the benefits can go on forever. I mean, a lot of people are apprehensive about accessing an emergency room, even if there is no COVID, because it can be such a traumatic experience for individuals that we support. So that's part of why we looked at Station MD. And I know they're going to be doing a presentation for you all later. It is either a telephone, you can call them on the phone, or there's an app and you can put it on your phone and you can try to access their information through that app. So all of those things are, and we can use the app to like a face-to-face telephone visit, or we can also just do it over the phone. So there's other things that you can get too to help make the Station MD visit more useful. A lot of our residential providers are working on that. That's specific blood pressure cuffs, some things that you can use to measure vital statistics. So Station MD has turned out to be a really great tool for us. We're very excited to have it. We're also excited that the General Assembly and the governor both agreed that we should continue this service because of all of the great the great response that we're getting from the service. And CMS, our federal Medicaid partners agree too, because they just agreed to include it into our waiver as a waiver funded service. So lots of good stuff on the Station MD front, and please stay tuned later today for the Station MD presentation. They will really walk through those details for you, but they can do medicine refills. They can tell you if you've got any questions about COVID vaccination, they will answer those questions for you. And just day-to-day healthcare as well. So please use them as.
Thank you, Val. Yeah, absolutely. And I know from having read about Station MD that these doctors and medical professionals that are involved in Station MD have very specific medical knowledge for managing health concerns for people with developmental disabilities. So it's not just your everyday general practitioner. These people really have specific experience and expertise and working with individuals with developmental disabilities. So it is a fantastic program. And again, unfortunate that COVID had to come along for it to come about, but how awesome it is that we have found it to be such a benefit, and we'll be able to move forward with it even once we are past this pandemic. So some pieces in the chat. I think Val already answered. Station MD can be serviced over the phone as well as virtually. So it is great access for individuals. I do want to kind of go back a little bit to a few of the COVID questions that we had earlier in the chat. Dr. Stanislaus, I saw someone say that they really physically cannot manage a mask. And is a face shield something that will effectively work to help kind of with the masking part of mitigating COVID?
So with the face shield, when you're looking at it, it's covering here, but it's open down. So yes, it is a little better than having nothing, because if you're having nothing covering your face, the saliva is spewing out when you're speaking into the air around you. But if you have a shield, it'll protect some, but it's still going to escape through the bottom. What we found is now with a face mask, there are so much you can actually tailor make to your size in such a way that you have enough room around here. So typically what happens is people find it difficult because it's so flat in the front that people cannot speak and they feel like they cannot breathe. But if you can really find a good roomy mask that actually covers your nose and your mouth, but yet protects this area, it's just a trial and error to find the right mask. So the short answer is a shield is better than not having anything, but a mask is what is truly going to protect you and protect others around you.
Now, I have seen actually, and I don't know for sure how well they work, but I have seen some like little plastic sort of inserts that cover this area of your face, like you said, the triangle part, and then your mask kind of goes over that, so that you do eliminate that that sort of anxious feeling that can occur when you're breathing in and the mask kind of sucks into your mouth. I know that can be just a really kind of disturbing feeling. So are those plastic pieces to put under a mask okay to use?
Yeah, they're fine. There are so many available. The bottom line is you cover your nose and the mouth and have as little air escape out of your nose and the mouth as possible, or suck in from your nose and your mouth as possible. So that is really the principle. You can find so many. There are people who have bandanas that they pull up to their nose and their mouth. There are so much options available. Just work till you find one that works the best for you.
Great. Well, we are coming up on our time, and one thing I did not do, I completely did not do at the beginning of this panel, was give each of our panelists an opportunity in about 30 to 60 seconds or so to kind of introduce themselves. So we'll do it in reverse, and we'll kind of end our time today telling us a little bit about yourself, what you do for the Department of Mental Health, and any final words you'd like to share with our participants as we wind down this time today. Dr. Stanislaus, I'll let you go first.
Yes, I'm the Chief Medical Director for the department, so have been leading the COVID pandemic, the efforts through the COVID to keep our staff and our patients safe during this entire period. It's consumed my life for the last 18 months or so. But one thing I really want to say is, please don't underestimate the effect of vaccination. Think of it like multiple layers. Somebody asked, can people be vaccinated and still die? The question to ask is, what is the risk of me dying if I was vaccinated versus if I was not vaccinated? That is the question. Anything and everything is possible. There is data that clearly shows that you're 25 times more likely to end up in the hospital if you have COVID if you are unvaccinated versus if you're vaccinated. If there's any medication out there that's going to lower my risk 25 times lower, be it my diet, a certain diet, be it a medication for diabetes, be it a medication for hypertension. We don't even have medication for schizophrenia that are that effective. So if there is something that is that lowering my risk to be 25 times less of me, even if I get the COVID, to end up in the hospital, that is important. So yes, are people having breakthrough infections? Yes, they are, because the virus is smarter and is 2 steps ahead of us. We are always going to be playing catch up. But what is the chances of me dying or ending up in the hospital without the vaccination versus if I take it? That's a very important thing to remember. The other thing I really, really want to use this forum to announce or talk about is, if you are someone who's taking care of somebody with an intellectual disability, you have one or you're taking care of somebody with intellectual disability, remember, the individuals with intellectual disability are 3 times more likely to die of COVID than without, taking into account of anything else. No, forget about other comorbid factors. If you have intellectual disability, or you know of somebody who has intellectual disability, you're 3 times likely to die of COVID than if you did not have. So it's so important that we get them vaccinated. If they cannot mask and if they cannot social distance, it is the responsibility of people around them to cover this area, mask and socially distance for their sake. And if there are guardians, the guardians should have adequate information, the right kind of information, so they can make the right decision for their ward. So with that, that is my message for today.
Thank you, Dr. Stanislaus. We appreciate all that the time, energy, and blood, sweat, and tears that you have put into keeping our staff and our clients safe at the Department of Mental Health. I'm going to toss over to Nora real quick, because I know she's got to jump off for another call here momentarily. Nora, tell us a little bit about yourself. You're in a new position here at the Department of Mental Health.
Yes, many of you will remember Dr. Rick Gowdy, and he was a blast to work for, but he decided that retirement might be a bit more fun. So he passed along his position. I took that in January. I've been at DMH for a very long time, 20 years, and have done a variety of things with both mental health and substance use disorder. And long time ago, I actually used to visit places in the community who also served individuals with developmental disabilities. I'm just thrilled to be doing this with some amazing people, and we have a lot of opportunities that have come about as a result of some federal funding. So I'm excited that we're going to be able to bring some innovative strategies and some much needed services to the community to increase access. So thanks for having me.
Well, thank you for taking time to be with everybody today on the Real Voices, Real Choices Conference. Val, I'm going to toss to you for wrapping us up for the day.
All right, I will do the wrap. So a lot of you may know me. I used to be the Division of Developmental Disabilities Director. I moved from that job permanently in May when Jessica Bax took over, and I am now the Deputy Director for the Department of Mental Health. And just as a wrap, I cannot encourage you enough to get the right information, to get vaccinated, to wear a mask. It is our responsibility to take care of everybody in our community that we support. Every time we have a bad outcome, we take it personally here at the Department of Mental Health, and we will continue to push information to help folks make decisions that need to be made. So thank you all for your time. Thanks for your support. Thanks for tuning in, and good luck with the rest of the conference.